Somewhere right now, someone is lying in a hospital bed, completely unconscious, and their brain is still running. Not shut off, not empty, running. For decades, doctors assumed coma meant nothing. No thoughts, no experience, just silence. Then they started scanning the brains of people who couldn't move, couldn't speak, couldn't even blink on command. And some of those brains lit up exactly like someone who was awake, thinking, listening, answering questions with nothing but their thoughts. Some patients have described their coma afterward. Time bending, voices from the room, warped and far away, dreams that didn't feel like dreams. So the real question isn't whether you're there during a coma, it's where there actually is. But coma is not sleep. Sleep gives you a way back. A coma may not. That word gets used for everything, but the borderlands have names. Coma, unresponsive wakefulness, minimally conscious state. They are not the same room. In deep coma, the eyes stay closed. The body can't be called awake. After coma, some eyes open, but the person may still not answer. Then tiny signs appear. A gaze follows a face. A finger moves once. Miss it, and you may mistake a person for absence. Consciousness has two pieces. Wakefulness is the power. Awareness is what fills the room. Your name, your fear, your memory. A coma damages the power system, or the wide networks above it. When those links fail, the room inside can vanish. But damage is rarely neat. Some pathways die, some pathways flicker, some keep carrying signals. In 2006, a 23-year-old woman in England changed the question. After a car crash, she was diagnosed as vegetative. At the bedside, she followed no command. Then, doctors slid her into a scanner. They asked her to imagine playing tennis. Her motor planning area lit up. They asked her to walk through her house. Navigation regions lit up next. Outside, nothing moved. Inside, she was obeying. That split is the whole nightmare, and the tennis court is only the beginning. The deeper you go, the stranger the silence gets, until you reach someone who spent 12 years unable to speak and still answered the question his doctors needed most. By 2010, researchers tested 54 severe brain injury patients. 5 could change their brain activity on command. One was called Patient 23. He looked vegetative 5 years after injury, but the scanner gave him a keypad. Tennis could mean yes. Walking home could mean no. The body said nothing. The brain answered 5 of 6 questions, and the reliable answers were correct. This is not mind reading. It's harder than that. The patient has to hear you, understand you, choose a task, hold it in mind, and do it at the right time. That is a person using time. Time is not nothing. Now put that back at the bedside. No scanner, no glowing map, just eyelids, fingers, breathing, tiny movements. In Belgium, 103 patients were rechecked carefully. Of 44 called vegetative, 18 were actually minimally conscious. The missed signs were small, a gaze fixing, eyes following movement, the kind of sign your family might beg for, the kind a rushed room can miss. A 2017 study pushed it further. One exam was not enough. Across 123 chronic patients, a single exam missed too much. Repeated checks over 10 days changed diagnoses. The recommendation became simple: check again, because awareness can flicker, and flicker still counts. Then came the bigger number. In 2024, 241 unresponsive patients were tested across countries. They showed no command following with their bodies, but 60 showed it in the brain, about 1 in 4. Not all comas, not every patient, but enough to change the fear. The body can be offline. The person may still be trying. In Canada, Scott Routley had been unable to speak for 12 years. He was asked a question that mattered. Are you in pain? His brain answered no. For once, the signal was not trivia. It was comfort. So where are they? Not in one place. They are in whatever network survives. Think of a city after a blackout. Some blocks are dead. Some windows flicker. One basement generator keeps running. That may be hearing. It may be pain. It may be memory. It may be the inner voice you call yourself. The brain has a self-network. When consciousness drops, its links weaken. When links return, an inner world can return. Not fully, not cleanly, but enough to make a world. Hearing can survive before speech does. Some silent patients still process words. Some respond more to familiar voices. Your voice may enter a place your hands can't reach. In 2014, scientists used an Alfred Hitchcock film. Not a beep, not a single command. A real story with suspense. One patient's brain followed the plot. That means attention can hide deeper than movement. But hidden awareness is not the only place. Some survivors remember nothing. Gone. No dreams. No tunnel. No story waiting underneath. Others come back with fragments. Voices sounded far away. Time folded wrong. Rooms became prisons. Pain became part of the dream. A 1988 study followed 15 coma survivors. 7 remembered nothing. 8 described worlds, imprisonment, death, strange senses with no stable body. Sedation can add its own chaos. ICU patients later described helplessness, procedures they couldn't stop, dreams stitched to machines, comfort when a human voice stayed near. So the room changes. If someone you love is there, speak gently. Tell them what you're doing. Don't perform despair over their body. Don't talk as if the bed is empty. No one can promise they hear you, but science has earned one rule. Treat the silence as possible presence. Care is not just waiting. Doctors now repeat exams. They remove confounders. They look for sedation. For some traumatic injuries, amantadine can speed recovery. For rare patients, even a sleeping pill can paradoxically wake circuits. Not a miracle, a clue. One man improved after deep brain stimulation 6 years after injury. 6 years. The old certainty cracked. Some brains are not dead switches. They are circuits stuck low. And pain cannot be dismissed. Minimally conscious patients can show pain network activity. So comfort is not decoration. It may be the only kindness that gets through. So you may go nowhere. The networks fail too deeply. You may go into fragments, a voice, a pressure, a memory. You may go into a dream built by noise, by drugs, by fear. Or you may remain in the room, hearing questions, holding answers, with no muscle left to send them. That is why the old question was too small, not conscious or unconscious, not here or gone. A damaged network can make many kinds of there. Maybe you don't go anywhere. Maybe the world leaves you, one pathway at a time, until only islands remain, a voice, a pain, a memory, a tennis court in the dark. And somewhere inside it, a brain is still trying to say yes.